Hello, this is Dr. Tyler, Hamel, Kingwood Chiropractor, and we are going to demonstrate plantar fasciitis treatment. So first we need to go over kind of what plantar fasciitis is and look at some of the anatomy. So plantar fasciitis, if you look on the bottom of the heel here, I kind of put an X where most of the people will feel the pain. So your plantar fascia lies just like this on the bottom of the foot. So everybody has one, but plantar fasciitis means that it's inflamed. So usually when somebody goes to step down out of bed in the morning and they have severe pain, scorching tight pain in this area here, that's plantar fasciitis. So just to treat here, or just to do a shot or a anti-inflammatory here, that might help a little bit, but we have to see where it's coming from in the first place. So here's what we look at, the kind of the chain. We have the calf up here, the Achilles tendon here, and then the plantar fascia on the bottom. So the blue lines here, it's basically where the calf is located, and calf tightness a lot of the times is going to put extra tightness on the Achilles tendon, which is going to put extra tightness on the plantar fascia. So in order to get rid of plantar fasciitis, we have to address the calf muscle here. And the calf starts up here, comes all the way down. It's tight on a lot of people, sometimes women wearing high heels or runners, anything. There's always stress or tension on the calf muscle. So I'm going to demonstrate a treatment here. We're going to try to loosen up the calf first, and we're going to work on the ankle and the joints of the ankle as well. Okay, so now we're going to stretch the calf, basically the massage initially to try to get more blood and circulation into the calf muscle, so when we stretch it, we'll be able to get a little bit better of a stretch or response. So I'm just going to push down on the heel here, and the calf is a big muscle, so we want to try to stretch it on a couple different planes. So you can see as I'm kind of pushing down in this area, I'll kind of move the heel around to try to stretch the outside of the calf, try to stretch the inside of the calf. So we're going to do this for a good 2 minutes. Initially when we do the massager, we're going to do that as well for about 2 or 3 minutes. And then we're going to work on the joints of the ankle and of the foot. And usually when we're doing this stretch, the patient's definitely going to feel it in the calf, probably the Achilles as well, and maybe a little bit on the bottom of the foot. So we're really stretching out all 3 areas by doing this kind of stretch. Okay, then we're going to work on the joints of the feet and the ankle. You can flip on over. Okay, so when we look at the joints, we're going to have joints of the ankle itself, and then we have all the joints on the toes here. There's so many little joints in the ankle and the foot that are affected by the plantar fasciitis, and just tightness of the calf, tightness of the muscles around the area. So we just come in here and we're just trying to loosen things up, right? When the muscles are tight, say the calf, the Achilles, or the plantar fascia, it kind of restricts the joints in the foot or the toes from moving like they should. So that kind of makes things worse over time. So I'm just feeling around, trying to get a little bit more movement here. Then I'm going to come into the toes, same kind of thing. Good. Back of the heel too. So we're just trying to get some good movement in all the different joints in the ankle and in the toes. Okay, so that's a treatment for plantar fasciitis. If you're having problems with plantar fasciitis, or definitely tenderness underneath the heel, that is the most common presentation of it, especially when you're stepping down. Say if you're wearing sandals or stepping down from bed in the morning, that's probably the most common complaint from patients. If you need some help fixing that, give us a call, 281-360-8387. Thanks for watching the video.